Hi everybody, Glenna Miranda here from the Benefits Office at Comal ISD. Despite all the craziness of the past, present, and probably upcoming weeks, it is time still for annual open enrollment for the upcoming benefit year. Remember, open enrollment is your chance to review your current benefits and make any changes, additions, remove things to the benefits that you're currently enrolled in. Our plan year still runs from August 1st through July 31st, so any changes you make during this time will be effective on August 1st, 2020. Also, because of the school closures and the fact that we can't meet face to face, welcome to your virtual open enrollments benefit meeting. The goal of this video is to review the changes for the upcoming plan year and also provide you with the information on how you'll be completing your enrollment this year, which will also be online. All of this information is posted on the Comal ISD website on the benefits page. You can get to it from the Human Resources page or the employment page at comalisd.org. Please look over the FAQs as well. That will probably answer many of the questions that you might have. But remember, you can always send me an email if you have a specific question, and I'm happy to answer. Also, every single employee needs to log in and enroll in your benefits for next year. Even if you've declined everything in the past and you plan on declining everything this year, you still need to log in and make sure we have that decision on file in our system. So before I walk through each benefit individually, just be aware that there are some changes to the benefit providers this year, with many of our supplemental benefits especially, and we have a couple of new offerings for you that we've not had before. So look everything over and let's get started. Okay, let's start with the health insurance. We are staying with Aetna for the upcoming plan year, and remember the new plans will be effective August 1st, 2020. However, our deductibles still do run with the calendar year. So if you change your plan August 1st, remember that any deductible that you've met between January and July 31st will transfer over to the new plan and continue through December 31st. If you're on the elect choice, or what we call the open access network, that's the broad network of Aetna, there's an overall rate increase of 5%. Remember, that's an increase to the total premium, which includes the district portion of $390. So an example, if you're on the low EPO plan on the broad network or the open access network, currently if it's employee only, you're paying $167 a month. August 1st, that would increase to $195 a month. If you're enrolled in the Whole Health Baptist or the ACO plan or network, that's the regional network that's local to San Antonio, New Braunfels, and San Marcos. We have some good news there. There's an overall rate decrease of 2% to the overall premium cost. So an example on that plan, if you're on the low EPO plan on the Baptist network, this year you've paid $135 a month if it's employee only. That will change to $125 a month beginning August 1st for employee only. We do have just one plan design change. Most of the plans are all staying the same copays, same out-of-pockets, but the low plan on both networks, that's our most popular plan. About 65% of our employees choose the low EPO plan. That has a reduction in the deductible for next year. It's currently $4,500 and that will go to $4,000 starting August 1st, and that still is per calendar year. So the deductible is going down slightly on that plan. We also have a new plan that we're offering in the upcoming year. It's a high deductible plan, very similar to the current high deductible plan that we have, except the deductible is going to be higher. It's $6,450 a year, but they have arranged the plan at the cost for $390 a month, which means for employee only, they will have a zero premium for that plan. That's going to be a nice thing. That plan will still cover all of your wellness benefits at 100%. So if you needed to go for your annual physical, flu shots, immunizations for kids, if it's time for your testing that you do for a mammogram once a year or maybe your colonoscopy, those are all still covered under the wellness benefit, even on our high deductible plans. But just remember, a high deductible plan doesn't have copays if you go to the doctor for a sick visit or any kind of testing or prescriptions. You pay out of pocket until you meet your deductible. But the good news on that one is it's going to be a zero premium for employee only on that new plan. So look that over on the website and see what you think about that. Hopefully that'll be a good thing for some of our employees that have not had health insurance in the past. It will help them because they will not have a premium if they just choose themselves for the plan. The Baptist Health System is a growing network and they are adding providers all the time. And so recently they've added WellMed clinics as well as Gonzaba primary care clinics. And so that means there's now a clinic in Spring Branch as well as Canyon Lake. If you want to look for providers and clinics in either network, you can go to docfind.com. MedFirst continues to offer $5 copays for primary care visits for our employees that are enrolled in the health insurance. And if it's for a sick visit, they are still trying to do same or next day appointments for our employees. All of the plans also still provide TeleDoc, which is an online appointment for a $40 copay. That could come in handy with all of us having to stay home more these days, but you can speak to a doctor 24/7, 365 days a year. We're also going to have our Ask Alex tool available online where you can go log in and just answer some basic questions, and it will help you evaluate your plan choices for next year. So look for that on the website if you have any questions and kind of want to get an idea of what the different plans offer. Alex is a good tool to use for that. We do still offer a variety of tax savings accounts. One is the Flexible Spending Account, or FSA, and that has been recently under TASC, or TASC. That is moving to National Benefit Services. So if you currently have a debit card with the FSA under TASC, you will be getting a new card. So you'll be able to use your current card through the end of July, and then you will have a new card to use for your new enrollment year effective August 1. Remember, with an FSA, you do need to spend the money in that account by the end of July. If you have the dependent care and you're going to re-enroll in the dependent care account, which is another way to save tax dollars by sheltering money and then reimbursing yourself for daycare expenses, that will also switch to National Benefit Services effective August 1, 2020. If you're enrolled in the high deductible health plan, either one, either the 5,000 plan or the 6450 plan, you're also eligible for an HSA, or a health savings account. You can only have a health savings account if you're enrolled in one of the high deductible plans. That is staying with HSA Bank, so there's no need to change that. If you have not ever done an HSA and you do have the high deductible plan, I do recommend that you look at that and maybe put some money aside into your HSA to use for medical expenses. That will not only save you tax dollars, it allows you, when you do go to the doctor and have to pay out of pocket, to use that debit card to pay for any medical expenses you have that come up. The difference between an HSA and an FSA is just a couple of things. The health savings account, whatever money you put into that account rolls over to next year. So you can continue to use that money. It does not expire and you don't lose it. If you have a flexible spending account, or an FSA, and that's the one you can roll in with the other health plans, anything except the high deductible plan, you do have to spend that by the end of July in order to keep that money. So you want to be a little bit more careful about how much money you put into an FSA versus a health savings account. The maximum per year you can put in a flex account is $2,750 for 2020. Dependent care has stayed at $5,000, and then the health savings account is $3,650 for 2020. So for our dental plan for next year, we had a group that got together. We went out for an RFP because our contract with Lincoln was up after 3 years, and they had proposed another rate increase for our dental plans. So we did choose a new dental provider, and the group chose Aetna to be the new dental provider. So next year, starting August 1st, Aetna is going to be both the medical and the dental provider. There are no changes to the benefit coverages under the dental plan, even though we're switching to Aetna. We still offer the low plan and the high plan. The low plan covers all of the basics. So if you need your regular exams twice a year, your routine screenings, x-rays, things that are covered under preventive measures, those are covered at 100%. Anything like basic services such as fillings and root canals, that's covered at 80% on the low plan. Those are covered on the high plan as well, but the high plan adds some additional benefits for major services like root canals that are more invasive, or perhaps crowns and dentures. Those are covered at 50% under major services. And then it also adds an orthodontic benefit for children under the age of 19. So the high plan has a $1,250 annual maximum. If you don't use all of that every year, up to $300 will roll over to the next year, 3 years in a row. So you can eventually have an $1,800 maximum if you have not exhausted all of your annual maximum on the high plan. The low plan does not have any kind of rollover. It just has a $1,000 annual maximum. Those are the dental benefits. Again, those are not changing. They're just moving from Lincoln to Aetna. Our vision plan is staying exactly the same. We're staying with Superior Vision, no changes to the plan or the rates, and they've actually given us a 3-year rate guarantee, so we'll keep the same plan and the rates for the next 3 years without having to change. Our disability plan, and remember, disability insurance is basically insurance on your income. So if you got hurt or were sick and could not work, it would pay up to just under 70% of your current income if that's what you enroll in. And then again, there's an elimination period. So you can sign up for a 7-day wait, a 14-day wait, a 30-day wait. And what that means is you have to be disabled for that many calendar days before the benefit kicks in. It's still going to have that first day hospital benefit, so that if you do spend the night in the hospital, the benefits pay from the first day. So that's how our plan turns into a short-term disability plan for maternity leave, because it does pay for 6 weeks for a regular delivery or 8 weeks for a C-section. Currently, we've been with the standard for several years for our disability insurance, but we are moving to the Hartford. So Hartford will be covering our disability insurance as of August 1st, 2020. No changes to the plan design or the rates. The rates are going to continue at what we currently pay. Standard had proposed a rate increase, so we decided to move to the Hartford. If you are currently receiving disability benefits and those are going to continue beyond August 1st, Standard will still continue to pay that benefit. But starting August 1st, if you're disabled after that date, the benefit will come from the Hartford. So if you're currently enrolled in disability insurance and you choose that again, when you enroll online, it's going to be seamless. It's just going to transfer over to the new company effective August 1st. If you're already pregnant, that's going to be a question that a lot of people ask, and it switches. As long as the baby comes after August 1st, then Hartford will pay the benefit. If you deliver this summer and you currently have Standard insurance, Standard is going to be the one that pays your disability benefit. So if you have any questions about that, you can look online or send me an email and I'll be happy to answer. We still offer 2 types of life insurance for the district employees. Permanent life insurance, which is not changing, it's still under Texas Life. And permanent life insurance basically is what it means is when you enroll in it or when you add a policy, you lock that rate in. It's a permanent rate. Also, it's portable, so you can take it with you if you resign or retire, and you can just continue to pay for that policy directly to Texas Life. So it's an individual policy that you can take with you at the current rate that you're enrolled in. We're switching our group term life insurance or our voluntary life insurance from Lincoln Financial to Unum. So if you're already enrolled in a Lincoln term life insurance plan, it will automatically switch to Unum August 1st, 2020. You don't need to do anything other than just enroll in your current benefits, and it's going to automatically switch to Unum as of August 1. It's a group term life insurance policy. If you want to add insurance with Unum, you do have a guaranteed issue up to $200,000 with no health questions asked during this open enrollment period. And if you're enrolled in at least a $10,000 policy at the beginning of their offering, then they will continue that guaranteed issue over the next several years for up to $200,000. So if you don't want to add extra insurance right now, you can enroll in a $10,000 policy, or if you already have something from Lincoln that's switching over, once you're with Unum, you can, like I said, guarantee up to $200,000 in the coming years if you wanted to add life insurance to that policy during the subsequent years that we have enrollment. We still offer a variety of supplemental benefits, and our supplemental benefits are the benefits that pay you the benefit directly. They're not tied to your health benefits, your medical at all. You are enrolled in a plan that pays you a benefit directly. Those include our cancer plan, our critical illness plan, our accident plan, and then we've added a couple of new plans this year, including a hospital indemnity plan and an emergency transport plan. So I'm going to go over each one of those individually just briefly to give you an overview and let you know of any changes. So the cancer plan is currently with Allstate. They have steadily increased their rates, and their rates are going to go up again next year. So we are moving the cancer plan from Allstate to Guardian. So you'll want to re-enroll in your cancer plan under Guardian. Now, if you have had no pre-existing conditions, if you've never been diagnosed with cancer and you have a cancer plan for that just in case, I would highly recommend you enroll in the Guardian plan. The rates are lower, the coverage is very similar, and it's also portable, so if you left the district, you could take it with you. The Allstate plan, if you decide to keep it, you can, but it's going to be through a bank draft only. We're not going to be deducting it through the payroll anymore, but you can keep that. You just pay them directly, knowing, however, that their rates are going up. Now, if you've already been diagnosed with cancer and Allstate is your plan, then I do highly recommend you continue that plan with Allstate. You will be able to keep that plan through a bank draft, and I'm going to have you call Rusty Freeman. He's our benefit consultant at U.S. Employee Benefits, and he is posted on the website, so you can contact him directly about keeping the Allstate plan if you've already been diagnosed with cancer. Again, you'll be able to keep that plan. Now, the Guardian plan, you might look at as well, in addition to the Allstate plan you have if you've been diagnosed with cancer. The Guardian plan has a 12-month pre-existing condition clause, which means if you enroll in it now, you would have to wait 12 months for benefits to kick in. But they will kick in after 12 months. With the Allstate plan, if you'd had cancer in the past, they just would not write a plan for you. So there is a benefit to having the Guardian plan in that you can get benefits after a 12-month waiting period. So look that over and give me a call if you have any questions, or give Rusty a call if you are considering keeping the Allstate cancer plan. The second type of supplemental insurance we have is a critical illness plan. In the past, that's been with Lincoln Financial. We are switching that from Lincoln to Unum as well, just like the life insurance, moving from Lincoln to Unum. The rates will be lower and the coverage will be very similar. If you just re-enroll in your benefits, you're already a member of the Lincoln Critical Illness, it's going to be a smooth transition. It's going to transition automatically to the new Unum plan. So shouldn't be any issue with transferring that over. You'll just re-enroll. The rates will be lower. The coverage, again, is very similar to what we have with Lincoln, with just some lower rates. The third type of supplemental plan we have is an accident plan. We've also had Allstate for the past 3 years for that accident plan. The accident plan has gotten very popular. It pays you a benefit if you have some kind of accident, car accident, a trip and fall, broken bone, anything like that that's due to an accident outside of work. Remember, it has to be outside of work. We are switching from Allstate for that plan to MetLife. The rates will be lower and the coverage is very similar. Allstate has had what we called an outpatient benefit payment. So you could go to the doctor twice a year and they would pay you a $50 benefit twice a year. It had a $200 maximum per family for that benefit. MetLife is offering a similar but higher benefit for a once a year wellness visit. So if you re enroll in the accident plan, it's going to automatically switch to MetLife. If you add it as a new plan, it will be under MetLife effective August 1. Their once a year benefit is actually $200. So once a year, if you go to the doctor for your wellness visit, you can file a claim and MetLife will send you a benefit of $200. They do not have a maximum per year for the family. So no matter how many family members are on your plan, each one of them will get a similar $200 benefit. So if you enroll your entire family, and there's 5 of you on the plan, you will each get a $200 benefit for going to the doctor once a year. Just keep that in mind. That's a nice benefit. It helps pay for the plan itself, and it would still pay if you had an accident of some kind. The new benefits that we're offering for next year, one is a hospital indemnity plan. So obviously if you have health insurance, it's going to pay your hospital bills, but you may have to meet your deductible, you may have an out-of-pocket you haven't met, and other copays. With a hospital indemnity plan, it pays you a daily hospital benefit, whether you're hospitalized for a regular visit or an ICU visit. The payments are for both types of visits. It also covers maternity leave. So if you have a baby and you're in the hospital 2 to 3 days, you will get a daily hospital benefit from a hospital indemnity plan. So you can enroll in that. It's a just-in-case insurance that pays in addition to your health insurance, and it is under the Hartford. So if you have any questions, look that over. There's some specifics in the benefits guide about how the hospital indemnity plan works, as well as the rates. Then the other new plan that we're offering for next year is called an emergency transport plan, and it's through a company called MASA. Emergency transport would be an ambulance or perhaps an air flight bill. Again, health insurance is going to cover if you have to be taken by ambulance somewhere or if you're airlifted somewhere. However, those companies tend not to be part of anybody's network. They are private companies many times, so they can charge the insurance what they want to charge, and then the insurance company, Aetna, Blue Cross, whoever it is, pays what they consider to be a reasonable charge. And so many times the ambulance companies and the air flight companies think that's not enough, and they will balance bill the patient or the employee for whatever they think is considered above and beyond what the insurance would pay. A lot of times that leads to mediation because patients get a bill that they're not expecting, that the insurance has said that is too high, we're not going to pay that. So this is just one of those supplemental plans that might cover a payment or a bill that you get unexpectedly for ambulance or air flight. Now, all of those supplemental benefits obviously are voluntary. Look them over and decide if it's something that you really think you need, if it's something that you're worried about as far as ambulance or air flight goes. It's something to think about. Things come up, and it's a good thing to look at. So, since we're all still stuck at home, at least as of this recording, how do you enroll in your benefits this year? Well, hopefully it's going to be an easy process, but we have a system set up that we're using called the Benefits Hub. Quite a few school districts in Texas use this already, so they're just adding us to the list, and it's a way to go log in. So you're going to create a user account and password, then you'll log into the Benefits Hub, and when you do that, your benefits that you're currently enrolled in should show there, and you'll be able to see all of your current benefits, and then enroll one at a time in what you want for next year. So you can keep everything the same, you can make additions, you can make deletions, you can add things, change things, whatever you decide to do. Just keep in mind that any changes you make, even if you're making them in May, they do not take effect until August the 1st when our new plan year starts. So open enrollment is going to be from May the 1st through May the 15th. That means you have 15 days to figure out your login, get it set up, get online, make your choices, submit it, and then it will go to me and I'll be able to review and make some checks and balances, and then we will start rolling everything into the payroll system for August 1. I get a lot of questions every year for people that are resigning or retiring and they're leaving the school district and they're working through the end of May, which means you're going to get a paycheck through August. A lot of times they assume they do not need to re-enroll in their benefits for next year because they're leaving. However, our benefit year runs a little bit different than the payroll year, and so you do need to go ahead and re-enroll in your benefits for next year, even if it's just going to be for 1 month. So remember, August 1st is when the new benefits take effect. You, if you've been working through May, will continue to get a paycheck through August. And so if you're leaving us and going to another school district and you don't want to lapse in your insurance coverage, make sure you re-enroll in your benefits. Otherwise, they'll stop at the end of July and you will not have any kind of coverage in August. So go ahead and do the open enrollment, make your choices for next year. Once I get your resignation processed, I will cancel your insurance as of August 31st, and then you'll have your new coverage wherever you are at your new school district on September 1. So just keep that in mind if you're thinking, I'm resigning or I'm retiring and I don't need to re-enroll. Yes, you do. If you have any questions about anything that comes up when you're enrolling in your benefits, there's a link for help on that website, but you can also always send me an email and I will try to help you as I can. I also have a lot of help with our consultants at U.S. Employee Benefits. Rusty and his team are amazing, and they are in the background all the time helping us try to figure things out and making sure things work. So just a quick review of what you need to do. Open enrollment will be May the 1st through the 15th. So between now and then, go ahead and go to the benefits page on the Comal ISD website and look over the benefits guide. That's posted as a PDF on the website. There are also FAQs for you to look over. Normally you'd get the benefits guide at our face-to-face meetings at the campuses, but that's posted on the website. So look that over. It's got all of the new providers, any changes that have been made, all of the coverage information is all there for you to review. And then May the 1st, you'll go to the Benefits Hub website, create your login and password, and then log in and make your changes to your benefits or keep them all the same, whatever you decide to do. And those will be effective August 1st, 2020. So review the benefits, then go to the Benefits Hub, create your login, and enroll in your benefits between May the 1st and May the 15th for your August 1st effective date. As always, you can call me, send me an email with any questions that you have, and I will be happy to help. I look forward to working with you again, and thank you for your time and attention.